Okay, so chapter 3 is going to be talking about the structure and the function of the reproductive system. So why do we have a reproductive system? What is kind of the function of the reproductive system? Well, the main function of the reproductive system is going to provide offspring. So we're going to have babies, continue the line of people going. And the way that we do that is inside our bodies, males and females, we produce certain things called sex cells. The technical term would be gametes. And males have certain ones that they produce, and females have certain ones we produce. So males, it's called spermatozoa, and those are sperm, and they're actually produced in the testes and down inside the scrotum, where females' sex cells are called ovas, or eggs, and those are produced inside the ovaries. When little girls are born, they're born with all of the eggs that they're going to have at birth. So many times those eggs just lie dormant and they don't ever become anything, but you have them from the time that you're born until you die. You have just so many eggs that will be there, where males can do spermatogenesis all the time and produce more and more sperm. Certain structures in the reproductive system they serve dual purposes. So like in males, they also use the reproductive system along with the urinary system. So it has kind of a dual purpose. Thinking about how does all of this start to happen? Well, certain things have to start happening in the body in order for spermatogenesis to occur and for the eggs to become ripe. So usually it's going to start at puberty, where little boys and little girls will start to go into puberty, and they will start to develop sperm cells, and they will start to have menstrual cycles. The first menstrual cycle that a girl is going to have is called menarche. It's the very first one they're going to have. Many times once they have menarche, a lot of times it's very irregular. They might have menarche and then not have another period for 6 months. They might have a period for a month. So it's very sporadic when they first start in menstruation. So it doesn't really get good and solid in a pattern for a few years afterwards. Where males can start producing sperm, live sperm, as soon as they start to go through puberty and the sperm is live. But it has to start here. So it's going to start in your pituitary gland. You have an anterior and you have a posterior. All of these hormones are going to come from the anterior, so they're going to come from the front of the pituitary gland. So, in females, we have what we call follicle stimulating hormone. And in a female, that's going to tell the ovaries that you need to produce estrogen. And estrogen is a hormone that helps ripen those eggs. In a male, it's what tells the testes to produce sperm. And then we have something called a luteinizing hormone. A luteinizing hormone in females, it actually causes that ovulation and stimulates the ovaries to produce progesterone. Progesterone is very important for the uterine lining to keep the baby inside there. So luteinizing hormone is what is being detected when moms are trying to figure out if they're ovulating or not. They use these luteinizing hormone strips, and that tells you when you produce luteinizing hormone, within 12 to 24 hours you're going to ovulate. So they know that that's the right time to have a baby. Where in males, they produce interstitial cell stimulating hormone, and that tells the testes to secrete testosterone, which is the male hormone. So a lot of our hormones, yes, our ovaries produce progesterone and estrogen, but so does it starts in the pituitary gland. So just kind of think it's not all just in that area down there, it's also coming from the brain. So puberty. Puberty is going to happen when that person becomes capable of sexual reproduction, and that kind of depends on age. We are starting to see little girls develop a lot younger. We're seeing menarche at a lot early ages now. Could be due to the diet, could be due to medications. A lot of things that we have in our society today could be causing some of that. But it's just maturation or maturing of those reproductive organs so they're ready to start working in a mature fashion. So how do we know that they're going through puberty? Well, they're going to start to get those secondary sexual characteristics. So they're going to get growth of pubic and axillary hair. They're going to get growth of external genitals. Breast development is going to be the biggest one in little girls. You will start to see breast bud development. And a lot of moms get kind of worried because they think it's a lump. and it's just breast bud development. And that's usually some of the first signs that you'll see in women, in little girls. Boys will start to get like some facial hair, their voice will start getting deepening. It might be a little bit kind of go different directions, and that's all normal. It's all from those hormones being produced, causing that maturational process. So they're responding to all those hormones. Usually puberty is going to kind of develop in an orderly sequence and kind of a timely variant. So it's going to kind of develop, this is going to happen, and then this is going to happen, and then that's going to happen. So that, again, that first period is called menarche, and that's the first time that a little girl's going to get her cycle. And that may be, she may have one at 12 and not have one again until she's 14. So it just kind of depends on, how her cycles do. Sometimes there's a lot of pain along with that, a lot of cramping, a lot of things like that. So just be prepared that it's going to be very irregular in the beginning. And so that's something that we need to prepare them for also. Make sure that they know how to use their supplies and all that kind of stuff. So the reproductive system in men. So thinking about the male, the genetic material in the male is actually what determines the sex of the unborn child. So a male is going to determine if they have an X or a Y. An X is a girl, a Y is a boy. Yeah, I had to think about that. So moms and females can only produce X's. So all of the ova have X's, and the males produce Y's and X's. So if we end up with two X's, we end up with a girl. XY is a boy. So that's going to determine if the baby's going to be a male or a female. So what is the purpose of the male offspring? It's going to be allow sexual intimacy with their partner, reproduction of offspring, and it also is a conduit for urinary elimination. So it's a dual purpose organ, so it allows multiple things to kind of occur. So thinking about male reproductive as far as like just the anatomy of the male reproductive system. External, so I want you to think the outside part that you can see. Well, one is the penis, and then you have underneath the penis, it's got the foreskin. That's the skin that goes over the top of the glans penis. And a lot of times when little baby boys are born, they go ahead and circumcise that. It just helps with infection. We usually encourage people to do that. Some people are choosing now not to do that, and that's fine. They just have to know that they have to pull that back, and they have to clean inside there daily and make sure that that stays clean, because we don't want them to get any type of urinary tract infections. And then the erectile tissue, and that the penis is what's going to deposit the sperm into the female vagina. And then the scrotum, it's where the testes are going to be housed outside the body. The reason that the scrotum is kind of, you got the scrotum that kind of hangs down, it kind of hangs down, and the testes are below that. They're not inside where the core body temperature is, because we want those testes to stay cooler. The more cooler that they stay, the better spermatogenesis that they have. So that's something that if someone's having trouble getting pregnant, a lot of times they will ask them to start wearing boxers or something. That way it allows the scrotum to remain cooler, and that can help with reproduction. So just looking at this is the glans penis here, and then this is one that is not circumcised. So if they're not circumcised, you do have to pull that back and clean. If they are circumcised, then you don't need to do that. So there's a lot of reasons for that. So the scrotum is underneath here, the penile shaft is here, and the glans penis. Just make sure you're aware of those. Those are the external. Then we're going to move to the internal structures. So the internal structures is the testes. They produce androgens and spermatozoa, or that gamete, those sex cells. They have semiviscerous tubules inside there that helps with secretion of like fluids to help with that ejaculate. Epididymis is where it's on the outside of like the testes, and that's where sperm is going to be stored. So sperm will be produced, and then it gets stored in the epididymis. And then you have that ductal system that transports everything, and that's your vas deferens and your ejaculatory ducts. So all of that's going to kind of push that out like that. And the hormone that men produce is testosterone. females do have a little testosterone, but not like males do. So just understand male testosterone. So if you're thinking about what testosterone does, it's not really related to sexual reproduction, but it does, when boys go through puberty, they start increasing that testosterone, and they have that increased muscle mass, increased strength, their long bones start to grow, the vocal cords start to get stretched from that testosterone that changes the tone of their voice, the distribution of different types of body hair. Many times boys or men will have a higher metabolic rate, basal metabolic rate, than females do. So males don't struggle quite as much with weight as females. Not all males, but that's just part of that testosterone that is inside there. They have more muscle mass than they have fat mass. So the internal organs. So we're going to have some internal organs. We have the accessory glands. So all these glands, that is what is in the ejaculate fluid. And usually that ejaculate fluid is very alkaline because if it's acidic, it's going to kill the eggs right off the bat. And so they never get a chance to penetrate. But the seminal vesicles, the prostate, the Cowper glands, or the bulbourethral glands, that fluid is very alkaline. So it enhances that sperm to move a little bit better, and it kind of provides food for that sperm so they can make sure that they can reach their end result, and it kind of protects them inside there. So that is kind of the purpose of that alkaline fluid. So semen is more alkaline than anything. It's kind of thick, whitish secretion. Usually the average volume is 1 to 5 mils. It contains several hundred to millions of sperm, and there is live sperm in that pre-ejaculate fluid. So that is something that you want to educate your patients on, that if you have especially young girls that think that, well, we'll pull, the male will usually say, well, I'll pull out. There is sperm in that pre-ejaculate fluid. So many babies have been made when they thought that they had pulled out, but that pre-ejaculate fluid still had sperm in it, and they became pregnant. So just think about that when you want to make sure that that is still alive. So there's the male reproductive system. You can kind of see how it's broken down. So you think about, you wonder why men might have trouble going to the bathroom, or you wonder why we have to put a catheter in so far. You think about the space that it has to travel. Here's the prostate gland. If the prostate gland swells or gets an infection, you can see how you could cut off the urine here, and that can make it difficult to be able to void. So we always have to think about that. You can also get an infection in the epididymitis. So there's all kinds of things that can happen in the male reproductive system too. So thinking about turning around here, and we're going to start talking about the female reproductive system. So what is the purpose of the female reproductive system? Well, one, to allow sexual intimacy and fulfillment, and to produce children through the process of conception. And then we're going to do pregnancy, and we're going to do childbirth. So that is the purpose of a female reproductive system. It's going to consist of external genitalia, we call that the vulva, internal reproductive organs, the bony pelvis, and mammillary glands. So we'll talk about each one of those and what their functions are. So external genitalia is the things that you can see. We call this whole section right here the vulva. And you got the mons pubis, which sits right up here. It kind of protects the clitoris. The labia are we have labia majora and labia minora, and that just protects the orifice. It protects the urethral orifice and the vaginal opening. And then we have what we call the vestibule. The vestibule has the urethral meatus, so it's going to be right up in here. It's going to provide that lubrication. It's going to the hymen's in there, and that hymen is that real thin little membrane that closes. A lot of years and years ago, they used to say that if the hymen was broken, that the female had sexual intercourse. So they used to take little girls to the doctor to make sure that that hadn't happened. That is not a good indicator of sexual activity. In the world we live in today, with all the sports that we do, tampons, all of that, that hymen is going to get broken very, very quickly. So it's not an indicator at all if there has been sexual activity. They have Bartholin glands on the outside that helps produce the lubricant, and they're usually not visible. However, sometimes women will get an infection in the those Bartholin glands, and they get very, very swollen and very, very sore. Sometimes they have to actually lance those. And then the perineum. The perineum is this section from here to the rectum. So if you're going to have an episiotomy, this is the place that it's going to be done, right there. So the reproductive system as far as internally. So when you think about the internal, we're going to think about, here's the bladder right here, here's the vaginal canal, and here's the uterus. There's the ovaries, and there's the rectum. So everything's kind of in close proximity there. But the vagina is very, very acidic. It stays acidic to kill any bacteria or anything that gets inside there. So a lot of times when we educate women on don't do any douching, don't use any vaginal sprays, don't do bubble bath, anything that can change the vaginal pH, because we want that vaginal pH to be acidic. Sometimes it can actually get too acidic, but we want it to be acidic because we want it to kill out all that bacteria. And if we do those douching or all that kind of stuff, it can change that acidity. Antibiotics is another one that can do that. Antibiotics can also kind of interfere with birth control, so we always want to make sure we let patients know about that also. And then we have a uterus. This is your uterus here. We have a myometrium, endometrium, and I've got another picture that I'm going to show you all that here in just a minute. And then we have what we call the uterine isthmus. This is a really narrow opening that connects the cervix to the body of the uterus. That is the spot that if the uterus would rupture, this is where it's going to rupture because it's thinner and not as big. So during childbirth, when things can get really, really contracting, or maybe mom has had a C-section and there's already a tear there or an incision there, that can rupture during childbirth. So that is something that we want to look at. That's the uterine isthmus, and that is going to be this early section right here. Fallopian tubes, that is what's going to carry the egg to the, I can't really see them on here, but that's what's going to carry the egg from the ovary through the fallopian tube into the uterus. The baby is going to get, when babies are formed, they're going to get fertilized in that fallopian tube. And then we have the ovaries, and that is where the eggs are going to be produced. So if you look at these structures here, you can see that we have our ovaries here. We have the round ligaments that are holding everything up. We have the fimbriae. These are like little fimbriae, and what they do is kind of when an egg is released, it goes inside there and then goes into the fallopian tubes and then drops down into the uterus. So that's how sometimes you can get an ectopic pregnancy. Sometimes this baby can get fertilized here, and then it drops down into the peritoneal cavity. It will not form a baby, but it may form certain parts. So you may see certain things of that. This is the perimetrium. This is the outer layer. Peri means around. And then we have the myometry. That's going to be the muscle layer. And then we have the endometrium. So that's the inside layer of the uterus there. And then we have all the stuff that's going to hold everything up during that. And there's your Bartholin glands right outside there. And the external os, that just means the external mouth and the internal mouth of the cervix. There's that uterine isthmus right here, that little thin section right there. So we do have, when a woman gets pregnant, one thing that we want to look at is the bony pelvis, because some women aren't able to have a baby come through there because of the way their pelvis is shaped. So we have to kind of look at their pelmetry and kind of look at the shape of that pelvis. So the pelvis kind of comes in two bones, the sacrum and the coccyx. So what that bony pelvis, does is kind of support and distributes that body weight. It supports and protects those pelvic organs. It's the passageway for the birth of the baby. And there's several different types of bony pelvises. The best one is going to be your gynecoid, and I'll show you that one right here. The gynecoid is the most common. So when the baby comes through here, the baby's face is going to be facing one of these directions. So you can see it's kind of like a nice oblong-y, sort of like a circle. So most people will have that type of bony pelvis. It's 50%. Then Android is kind of this heart-shaped. Not a lot of babies are going to want to come through there. Arthropod, this one, they can delivery vaginal, but the baby is probably going to come sunny side up, which means their face is going to come down first. And then the platypoid is only 3%, so not a lot of babies are going to come through that pelvis. So the most common pelvis that we're going to see that is better distributed for the passage of a baby is going to be your gynecoid pelvis. Then we have the breast. So we think about the breast. The whole purpose of the breast is provide milk after birth. It gives that nourishment to that baby. It also provides antibodies to that baby from mom to baby. It does take 3 days for the milk to come in. So a lot of moms are like, well, my baby's starving. They're not really starving. They're living off a lot of fats and things that they have. Sometimes we do have to supplement a little bit, especially if they're born and their blood sugars are a little low. Sometimes we'll supplement a little bit with some formula. Sometimes we'll give sugar water, sucrose. There's certain little things that we can do to kind of make sure that their sugars stay up a little bit higher until that milk comes in. But many times these moms are home before their milk comes in. So a lot of times when their milk comes in, it's very painful, it's very uncomfortable. So many women stop breastfeeding at that point because there's nobody there to talk to them. Montgomery glands, these are just little small sebaceous glands. They secrete and lubricate and protect the breast during lactation. So they just keep little lubricant on there that helps with that. Breast milk is very healing. So a lot of times if they get breast problems, we tell them to express a little bit of breast milk and rub it on the nipples, and that will help keep the nipples lubricated and feeling good. A lot of moms will say, well, I had a breast augmentation. Can I still breastfeed? Yes, you can. You can still breastfeed even with the breast augmentation because they go actually underneath the muscle. And so it doesn't affect your breastfeeding. Okay. All right. So reproductive cycle. This is how we're going to get pregnant. So the reproductive cycle and how we menstruate. So when a woman's first menstrual cycle is going to happen, you're going to start getting the development of those breast buds, like I talked about a little bit earlier. That first menstrual period is called menarche. Usually comes about 2 to 2.5 years after they started getting those breast buds. So anytime between 11 and 15 is when menarche is going to occur. If you have a female that is 16 or older and has not had a menarche, they will usually have the doctor take a look at them and make sure that there's not something structurally wrong. Sometimes women can be born without a uterus. They could be born without ovaries. They could be born with, maybe they don't have a vaginal opening. So there's lots of things that we need to look at structurally that needs to be investigated before we move on to something else. Usually during that puberty stage, women are going to stop growing quicker than males. Usually women will be done growing by 15, 16 years old, about 4 years into their menstrual cycles, where sometimes males can even grow up into their 20s. Females' hips are going to broaden. They start getting, boobs and butts is what I say. So their hips start getting bigger. They start getting the pubic and the axillary hair. Menstruation starts to come. Again, I talked earlier about seeing menstruation happening earlier. We're seeing it happen early. We have a epidemic of obesity, and that tends to bring on menarche sooner. They are exposed to a lot of different chemical exposures. Think of all the things that are put in our processed foods, our meats, chickens, all of that to make them produce faster, make them produce bigger. So there's lots of different kinds of steroids that are being put in the food. Okay, so your menstrual cycle. It's kind of like a recurring changes in that reproductive tract all the time. So menstruation is when blood and debris and old endometrium tissue just sheds. So it just, the baby did not implant, there is no baby, progesterone levels fall, and then you start to have menstruation. Usually lasts anywhere from 4 to 6 days. Total blood loss, it's not as much as you think, 25 to 60 mils. Seems like it is a lot more than that, but it's really not in the scheme of things. And those hormones that we talked about in the beginning, all of that's what's going to regulate this process. So it's going to respond to those hormones from the hypothalamic or the pituitary gland, and that's going to kind of make the ovarian cycle and the uterine cycle happen. So the menstrual cycle, day 1 is the very first day that you start your period. So the very first day you start your period is day 1. and that endometrium is starting to break down. So it's starting to break down. There was no baby that implanted, so the progesterone levels are going to go down. There's no baby. Estrogen levels are going to go down. About day 5.5 to 6, we got a new follicle that's starting to develop in the ovary. Then that follicle gets mature, and then we have that luteinizing hormone will start about right here. And about day 14 is when ovulation is going to occur. And that's the time when you're going to be able to get pregnant. And this is the time right here when, so it's a short period of time. It's about 24 hours. So it's a short period of time that that baby's going to be able, conception's going to be able to occur. But about day 14 right here, that's where your strips for ovulation are going to be positive. And then the baby will be released, and then the body's preparing for that fertilized ovum. So we have progesterone, all of this stuff happening, and then if no baby's implanted, progesterone levels drastically drop, and we continue to go through that cycle again, and we do that forever until we go through menopause. So the ovarian cycle, it's going to be occurring from the FSH, which is your follicle stimulating hormone. It's going to stimulate those follicles or those baby eggs, and the luteinizing hormone. So it has two phases that it's going to go into. It's going to go into the follicular phase, and that is controlled by FSH. That's days 1 through 14 back on that wheel. That luteinizing phase is controlled by LH, and that's day 15 through 28. And that's where that hormone is going to control that. The follicular stage begins to develop in response to those, the follicle stimulating levels start to rise, they start to go up. That follicle inside the ovary, it produces its own estrogen. So it produces estrogen. The pituitary gland goes, oh, there's an increase in estrogen, and so I'm going to release some LH because that's going to bathe that follicle and help with ovulation. So then you're going to ovulate. Those little fimbriae that are on the outside of the fallopian tubes is going to kind of draw that ovum inside that fallopian tube. And then the luteal phase, this is where LH is going to be elevated, and it causes those remnants of that follicle to develop a corpus luteum. So it's going to change from a follicle to develop this corpus luteum, or this outside edge, and it's going to produce progesterone. If no fertilization occurs, no baby occurs, that corpus luteum just starts to degenerate. When it degenerates, estrogen and progesterone are going to go away because that follicle and that corpus luteum produces that, and if there's no fertilization, it's just going to fall. And that leads us back to day 1 of that cycle, like we talked about a minute ago. As far as the uterine, what's going to happen in the uterus during that cycle? So this is where the inner lining of the uterus is going to respond to that estrogen and progesterone that's being made by the follicle that comes out. And it has 4 phases: menstrual, proliferative, secretory, and ischemic. And that's what happens inside the uterus in that monthly cycle. So we have a menstrual phase. So that's the onset of menstruation. That would be day 1. That uterine lining is shed because those progesterone levels and estrogen levels, there was no baby. So they plummet, and that starts to cause that to happen. So then the follicle begins to develop again in the ovary. That follicle starts to develop. It starts to produce estrogen, and then we move to the proliferative phase, where that endometrium starts to regenerate and starts to build back again when those estrogen levels get high, because the purpose of it is to make sure that that endometrium is ready for implantation. So estrogen levels go high, progesterone levels go high. That endometrium is like, ooh, I'm ready. I could house a baby in here. So it begins to develop and prepare for that pregnancy of the mom. So then the secretory phase is where that corpus luteum starts to produce progesterone. So we've got the estrogen, we got the progesterone now during this secretory phase. That uterine lining is still preparing for that pregnancy. They got that estrogen going, we got the progesterone going. Then if no pregnancy occurs, that baby doesn't burrow into that endometrium, then the ischemic phase starts. And the ischemic phase, when ischemia just means it's not getting something. So that ischemic phase starts when that estrogen and that progesterone go, we're out. So it's going to make it ischemic and not have any of that good stuff. So it starts to shed. And then we start that process all over again. So that's kind of how that uterine cycle does. So that cervical mucus, we have a lot of cervical mucus that can change throughout that cycle. During that menstrual phase, the cervix doesn't really produce any type of mucus or anything during the menstrual cycle, but the cervix produces yellow, kind of white mucus that's kind of tacky and crumbly when it gets dried. So that's kind of what the cervix produces. When ovulation gets closer, that mucus becomes more clear and real thin, and it has a lot of lubricating properties in there. And that's kind of important to know, because that's one of the things that before we had those luteinizing strips that told you when you were ovulating, this was one of the things that the doctors used to tell women to look for. They say, keep an eye on your mucus. The mucus will become more thin, and it's called spin barquette. It's where the mucus gets real thin and really stretchable. I don't know who's going to be playing with their mucus, but I don't know. But that's what they would tell them to look for. After ovulation, that mucus becomes, we don't have a lot, it becomes real thick and it becomes real opaque. So if you're really, in tune to your body, you will be able to see these changes that happen throughout that menstrual cycle. So if you can see this chart, it kind of tells you day one, here's your estrogen. Now the corpus luteum is producing estrogen and progesterone. Then if the baby doesn't, it just kind of spells everything out and what's happening. So you can see why women sometimes have those roller coasters of hormones where we may be happy one minute, sad the next minute, because it's a never-ending cycle of what's happening. So this is our period. This is where estrogen goes up. This is ovulation, where the ovulation occurs right here. All the estrogen, progesterone is high, preparing for implantation. Implantation doesn't occur, we have a period. So that's just kind of how that happens. This is what's going on inside the uterus here, and this is the ovarian phase. So you can see which phases are they in the follicular or the luteal, and you can kind of see what phases they're in here. So it's kind of important to understand the cycle and let people know that that 14th day of their cycle really is the best time that they're going to become pregnant. So after you've done your menstrual cycles for many, many years, you will go into what we call menopause. So menopause is, they define that as 1 year without any type of menstrual cycles. So that's when the women's reproductive capabilities end. It's kind of very, kind of a distressing time for certain women, because it's the end of an era that, I will never be able to have children again. It's kind of sad. It's a lifestyle change. You remember when we talked about losses, this would be a maturational loss. They have a maturational loss. Menopause is occurring. They're going into the later years of their life. This is where ovaries gradually just stop functioning. So their periods are going to get very irregular. Their menstrual cycles will get very irregular. Sometimes they get very heavy. Usually menopause is anywhere between 47 and 55. Can be earlier, can be later. A lot of that is based on, parents, grandparents, and, what their cycles were like. But during that menopause period, menopause is not something that's going to be a day or two. Menopause is something that lasts for 3 or 4 or 5 years to completely get through menopause. But a lot of things are going to be happening in the body: mood swings, sweating, trouble sleeping. That whole process before we actually get into menopause is called perimenopause. And that's just pretty common that people will get that. One of the things that they talk about in the book is the sexual response. Just be aware of it. There's the physiological responses, I'm not going to read this to you. You guys can go back and read this, and just understand that there's certain things that happen in the body on that sexual response. And that is chapter 3.